Fatigue is one of the most common and taxing symptoms experienced by people with lung cancer. Lung cancer and its related treatments can cause fatigue in patients. Fatigue is often characterized as feeling exhausted and weak. However, it is greater than simply feeling tired. There is much more to this complicated symptom. Between 80 to 100% of cancer patients report experiencing cancer-related fatigue, according to the Cancer Society.
Cancer-related fatigue, CRF, is different from ordinary exhaustion that you might experience after a long day. Fatigue caused by cancer persists even when you got plenty of rest or drank a lot of coffee. Many patients characterize CRF as paralyzing. There are two classifications of fatigue: acute, lasting a month, and chronic, lasting longer than a month. There are warning signs of impending CRF, including tired eyes and legs, stiff shoulders, lack of energy, boredom, and irritability. Signs of lung cancer fatigue often include feeling whole body tiredness, muscle weakness, persistent tiredness, difficulty concentrating, feeling emotional, sudden exhaustion, sleeping a lot. Extreme fatigue can also be associated with other cancer symptoms, such as shortness of breath, dry cough, and lung pain. Persistent CRF can interfere with life's general activities. As a result, as many as 1 in 4 people with cancer develop depression.
If you are experiencing persistent symptoms and are unsure of the cause, it may be time to discuss it with a medical professional. You should ask your caregiver or healthcare provider about CRF if you can't get out of bed. Experience sudden mood changes. Experience severe pain. Have memory problems. If you are aware of a cancer diagnosis and notice a change in your symptoms, you should also discuss it with your doctor. There are several potential causes of fatigue related to lung cancer. Patients can experience CRF due to the lung cancer itself, its associated treatments, or the general stress of experiencing cancer. For example, radiation can make people tired, and patients can experience fatigue after surgery. Some common causes of CRF include cancer itself, treatment and its side effects, shortness of breath, depression and anxiety, anemia, immobility.
Any type of cancer and treatments can cause CRF. However, it tends to worsen throughout the progression of cancer and its associated treatments. Many people experience CRF as an early sign of the presence or recurrence of cancer. Stage 4 lung cancer causes the most extreme side effects in patients. In advanced cancer, fatigue is a common persistent symptom after chemotherapy and radiation. Treating lung cancer fatigue. Even if you are in remission, you can experience post-cancer fatigue syndrome. Some patients can experience fatigue for weeks after, while others experience it for years. There are general tips to follow to fight CRF, including conserve energy, quit smoking, eat a proper diet, exercise, seek mental health support. If home remedies are not providing relief, medical centers can help. The best way to treat CRF is to address the underlying cause. However, it can be difficult to trace the exact cause. Some treatments and medications can treat certain causes of cancer fatigue, such as anemia. Most cases should be treated and managed on an individual basis. Early screening for lung cancer. Unlike testing, early screening for a disease occurs before the patient has any symptoms. When screening for cancer, early detection can encourage patients to seek treatment sooner when more curative options are available. The earlier cancerous cells are detected, the easier they are to treat with radiation, chemotherapy, or surgery. Catching lung cancer in an early stage before it has spread throughout the body can increase a patient's odds of survival and improve their prognosis. Today, lung cancer is the leading cause of cancer-related death in the U.S., making up nearly a quarter of all cancer deaths in the country. In 2018, nearly 250,000 new cases of the disease were diagnosed, and over 500,000 people today live with a lung cancer diagnosis, meaning the majority of diagnoses occurred in the last few years. Recently, the large number of new cases can be attributed to the late onset of symptoms and limited treatment options available at later stages of the disease. Learn more to stay informed about the latest lung cancer screening recommendations and guidelines.